moving back from motorcycles to plastic surgery, two things I guess I know the most about.
True.
A lot of people will message me on different social medias about cost of plastic surgery.
Okay.
And so I want to kind of go over that because there are a lot of costs that people may not know about, and then there's hidden costs. And I think if you're going to have plastic surgery, you need to be aware of these. And I'm not sure every plastic surgeon is upfront about this because they don't want to scare people off.
Right.
So let's talk about the known costs of plastic surgery. So, Robert, I'm putting you on the spot because you're here. Tell me, what's one of the known costs of plastic surgery? I know you can name one, right?
Well, like how much or?
Like what? I mean, what constitutes, like when you get a bill, it says $8,000 to, get my boobs done. Like where's that money going?
Okay, so great point.
Man,
now I'm thinking about it. You're paying for, if you're getting an implant, you're paying for the implant. What's
right,
going
okay,
in
that's
your body?
one. That's exactly right. Yeah, materials. So implants,
like
garments.
I say, it's like everything else. You get what you pay for, so you're paying somebody to do this
the surgeon.
for you.
Yeah.
So, yeah.
You're right. I was just
I know.
I was just messing with
you.
But you're right. So all right. So I'll go through them. But yeah, you're right. When you like ask somebody, it's like, okay, well, where's that money going? At first, you're like, geez, where is that money going? Right. All right. So
I bet you. Pause.
Okay.
I bet you get calls like, how much is it to like get a breast augmentation? How much is it to? And it's not.
So we usually give people like the total costs.
Okay.
Yeah, we wouldn't trick them by saying just what our fee is and then have them come in and be like, by the way, you owe this.
Did you want the floor mats?
Yeah, did you actually want the implants? No. Yeah, right, for the cars. So when you talk about plastic surgery costs, the big one's going to be the surgeon fee. That usually is the biggest hit because the surgeon will get a fee for doing the surgery. And why the fee is pretty big? Well, I mean, it comes down to overhead. Plastic surgery overhead is generally very expensive. There's a lot of marketing involved. It involves, having a really good website, doing social media, that stuff costs money.
But one of the things people don't think about is you having insurance coverage.
Malpractice. I mean, that can be big. That's really a state-to-state thing, though.
Yeah, but you got to have it, right?
Yeah, you have to have it. That definitely plays
regardless,
into it.
But all of those little things, you pay electricity to have.
Oh, yeah. Yeah, overhead.
Yep.
Surgeon fee. The next one that's the big one is the facility/OR fee.
Okay.
Now some surgeons have their own ORs, but you're still getting hit for a fee to use that room where the surgery occurs.
Right.
So typically the second biggest fee is going to be the OR fee. Then most of the time you're going to be under anesthesia. The anesthesiologist has to get paid.
That's a
right?
person.
Yep. So they have to get paid. You said one, materials. Now not every plastic surgery has materials. Like for example, if I'm doing a tummy tuck, like we don't charge people individually for the suture. That's part of the OR cost.
Right.
But you hit the nail on the head with implants, breast implants. The other thing would be if you use meshes. I did a surgery today where I used a mesh to repair somebody that had an issue with breast surgery in the past, and there's a cost for that. Like garments, like if you have to have a special garment, like a compression garment.
Right.
And then the last known cost, or it should be known cost, is medications, which that's pretty small, like pain meds, antibiotics, that kind of stuff.
Right.
So those are kind of the known costs of like what you would typically think of. Okay, I'm paying X amount of money for this surgery. Where is that going? It's going to those things. But then there's other costs. Okay. And this is where you have to kind of think about things, because where I've seen people get into trouble is someone, spends every last penny they have to have surgery and they don't anticipate these other costs. So I think one of the big ones you have to think about is time off work, right? You're having surgery and you're not going to be able to go right back to work for most of them. Some you can, like breast aug. I mean, we have people do them on Friday and go back to work on Monday. But for a lot of surgeries, you can't do that.
Yep.
And then there's often times where people underestimate it. Like, so part of my spiel when I do a consult is like, I think you need to take X amount off work. And they're like, well, I'm going to take this off, and then if I need to take more off, I will. I'm like, okay, that's fine, but just be aware that most people need 2 weeks, not one. And so, and that doesn't include if you have complications. Yeah. And that's kind of where one of the big hidden costs comes, is if something happens and things don't go perfectly smooth and you either have to take more time off work or you have to go back to surgery for some reason, that's going to incur more costs. And it could incur all the costs over again. Now, for my patients, if somebody needs to go back to surgery really for any reason, I don't charge them anything. Thankfully, I don't have a lot of people go back to surgery, so I can do that. Where if, if you have to go back, I'm not going to charge you nothing because I just want patients to be happy. But we don't pay like their OR time, and so they, that would be something that would pop up as a hidden cost.
Right.
Going along with that is like touch-ups. I mean, every once in a while I'll have somebody like say maybe their scar isn't perfect and they want to do a slight touch-up. Now, I try to do those in the office and then I don't charge people for it. But if a touch-up has to go to surgery, then there's going to be a cost. Even if I don't charge them the cost of the OR time and potentially anesthesia.
The drugs and the anesthesia.
Yeah, right, all of it over again.
Yep.
There's some follow-up treatments. So like sometimes people need things like lymphatic massage if they get a lot of edema.
Yep.
Sometimes people, like say for example, you get liposuction and your skin's loose, then you might want to get a laser afterwards because your skin's looser than you want it to be. Skin care, scar treatments, that kind of stuff, can add up. Not it's like super expensive, but can add up.
Right.
And then finally, some plastic surgeries do necessitate surgeries down the road.
Okay.
And the obvious one is going to be breast implants.
Okay.
If you get breast implants at 20 years old or even 30, chances are pretty much 100% that sometime in your life you're going to need those implants replaced or change to something different.
Yeah.
So you have to think about that. And, it's easy to think, oh, well, 30 years, I'm going to be rich and I don't have to worry about it. But that doesn't always work out. And so you just have to make sure that, you at least know about it. You know that, okay, if I do this particular surgery, somewhere down the road, I may have to have another surgery. Yeah. And I always tell people, like, especially, for women especially, having plastic surgery before having kids almost absolutely means you're going to have plastic surgery to get things back to where it is because pregnancy, does a number to your body.
Right.
So, and finally, just kind of sum this things up. I'm always tell people to be very wary of bargain basement plastic surgery. I mean, I know that should go without saying. Right. I mean, I personally wouldn't want to have surgery from the lowest bidder. I mean, it goes like with pilots too. I don't want the pilot that like is going to fly me around for $20.
Yeah.
I kind of want that to be expensive because, if somebody is charging very little money, there's a reason for that. They need the work. And you want to go to a plastic surgeon that's busy, right?
Well, and I look at it, I had a windshield replaced recently and they were like, you can go to this national company, but they're going to charge you a dispensing fee and this and that and whatever. And so it looked like it was cheaper, but to walk out the door, it was actually more. Yeah. And do you get somebody that know what they're doing? Yeah. So do it once and be done. And the other point I think that I was thinking of was every body's body heals differently.
Yeah.
I typically heal pretty quick.
Some people don't. They need more time off work, or maybe they won't, heal as well, and then might incur different costs on the road.
Let me ask you a question. What's the biggest question around that? Like the money and all of that stuff. Is there one that comes out all the time that people ask?
One that comes out. What do you mean by that?
Like a question, like, well, what about this, or that they're surprised by? What are most people surprised by?
I mean, part of like my whole thing as being a doctor and a surgeon is like I'm not scared to scare people off. Like I'm just bluntly honest about everything. Like I talk about every complication that might pop up. I'm like, hey, look, complications happen. There's a saying in surgery that's 100% true that says if you're not having complications, you're not operating enough, because the complication rate exists. It's not zero. And so if you're doing, I do 300 to 400 surgeries a year. When you're doing that many surgeries, like odds catch up to you eventually, and somebody's going to have an issue. And I'm very upfront with that about patients. And so I'm like, look, and the same thing about money. I'm like, and I always tell people like, look, I'm trying to save you money by doing this. Like, for example, you can unbundle plastic surgery because it's out of pocket. And then what unbundling means is one surgery includes 3 surgeries, or you can bill for 3 surgeries. You know what I'm saying? So I try to bundle stuff as much as I can and say, okay, we're just charging you one fee. We're not going to like unbundle this. And because like I didn't grow up a ton of money, so I'm always thinking about money.
Right.
And so like I'm pretty honest to my patients, about what the potential risks are, what the potential costs are. I don't really get, since I do that, and like I was trying to remember how I got off on that tangent, because you were asking about what people ask about. Because I really go into all that detail, we don't get a lot of people, to ask. We're just very upfront with information. So
that probably takes a lot of time then with the patient.
Yeah,
it
does.
Just like,
yeah,
how much is this?
Yeah, right. Yeah, we break it down by the penny. We're like, okay, this is what this is. This is what our fee is, and this is like the materials and. Right. And I'm very upfront about like if you have to go back surgery, like that's on you, right? I mean, I'm not charging nothing, but so I think at least for me in my practice, like we're pretty transparent. Good. I mean, that's important to me. I mean, I don't want. I know I've said this a million times. Like when people come to me, like I'm not trying to talk you into having surgery. I'm telling you like the straight truth. And if you want to do it and you understand everything about it, great, let's do it. But like, I'm not trying to trick people into do it or like hide stuff so that they do it, you know?
Right. Seems like a lot of it, you know, or the stories of people going, oh, I had this surgery and I was in the hospital and they charged me $80 for 2 Tylenol.
Oh,
Or,
yeah.
You know,
you'll see that all the
true or
time.
not,
But like, you know, that's like and I see those things on social media all the time.
Right.
People will pull up their bill. And the reason, I mean, this is total like a side note, but it's worth talking about. The reason that those bills look so stupid is because that's like what they charge the insurance, because insurance always pays like 20 cents on the dollar.
Mm-hmm.
If you actually charge the insurance what you wanted to get, you get 20% of it. So like they inflate these bills and then they get sent to the patient. The patient's like going on Twitter being like, look, the hospital is charging me $10,000 for a blood draw.
Right.
Ain't no one paying that. Like, you know, the insurance is going to give them like a fraction of that. And then at the end, you may have to pay something. So that's kind of like a, I don't know, bait post, you know?
Yeah.
I mean, don't get me wrong, healthcare is totally broken, but I mean, that's a little untruthful when people post that kind of stuff.
So I would walk out of your office knowing exactly.
Yeah, exactly, right, yeah.
I mean, other than something weird or crazy happens.
Yeah.
Which is me. I'm like, I just want all the facts so I can make that final
No,
decision.
we are pretty good about that. Because, you know, like I said, I mean, I'm fortunate. I've been practicing like a long time now, and like, you know, we have a good reputation. So we have a pretty steady stream of patients. And so like if I scare someone off, I mean, then that's fine. Like, you know, it's better for them, right?
Exactly.
You know, it's better that they reconsidered that if that's not what they really want to do. So
Cool.
All right, Robert. Thank you so much for coming on, bud. I appreciate it.
Anytime.
I really do
It's
appreciate it.
fun.
Yeah, you're good
It's
at this.
fun.
You know, you should start your own podcast.
You know,
dude,
why
Jeff's
not?
gonna hit Jeff's gonna hit Robert up to do his own podcast. Be like, Jeff, you gotta watch Robert on here. He's pretty good.
I mean, sometimes, you know, maybe.
should start
I
your
can
own
talk
show.
about anything.
I
Do
know
a
you
podcast about hair. Just do a podcast about hair. That's it.
about hairstyles that last that last the decades. You and Trump,
Yeah.
you guys could do a show about hairstyles that last a lifetime.
Hey, so Trellis, let's be honest. It's function over fashion, isn't it? I mean,
I mean, in some cases.
yeah,
In
it's
some
like
cases.
you want to look good, but like, how long is this going to take me? How much is this going to cost?
Do you think it takes a long time to do this, Travis? How long do you think it takes me to do my hair?
Oh, I think it probably takes a minute. Yeah, 'cause
1 minute?
No,
you
no,
mean
no,
like a
no,
long minute or a
yeah,
short minute?
A good while.
No,
How about
he's
that?
doing this and
no.
walking out.
No,
But
I grab wax and I do like this and I put it in my hair and then I kind of just go like that until I'm like, yeah, that looks good. And then I put some hairspray in it.
he's got to go see his girl.
Right.
and
Well,
all
I have a
that
team
stuff,
of people
yeah.
that make this happen.
I have a
do.
team.
I have a team of people. That
I
make this-
look this good, and it's just me.
That's funny.
I think that this show is about over.
Yeah.
All right, everybody. Thank you guys so much for tuning in. Hope you had fun. Please leave us a comment. We want to hear from you and let us know what you want us to talk about on the next episode of Nip Talk. See ya. Bye.